Okay, I can see you now. Awesome. Can you hear me?
Hello, she's on mute.
Okay, can you hear me?
I can, yes.
Oh, okay. Um, Diana, you're on mute. Okay, let me call her.
I'm gonna give her sharing privileges.
Hello, Rita. How are you doing?
I'm good. How are you?
Uh, Hi, Diana. I just wanted to let you know you were on mute. Okay. Um, and I'm going to, once you get off mute, I'm going to introduce you to our pro tem for First AME Church. That's Sister Rita Portmore. Okay. Okay. And also, our pastor will be on too as well. Okay, what's your pastor's name? Her name is Victoria, Dr. Reverend Victoria, Goddess. Yes, Goddess. Uh, you want me to do the Victoria,
Reverend Dr. Etoria V. Goggins, Goggins.
Okay. All right. I'm going to let you go. We're going to talk through the Zoom because there's too much noise coming through. Okay. I have to work just to get my presentation out so people that I'm planning to start going. Oh, okay. All right. Do you need anything from me? Okay.
Okay, Linda, I've given her
Hello?
the opportunity if she want to share her screen.
She has given you.
See, her screen still on mute.
She's getting ready. She's setting up right now.
Okay.
Yeah. Okay. All right.
You can hear me now?
Yes.
Let me see about the screen here.
All
right. That's what I'm working on now, trying to get my presentation in here.
Okay. I gave you sharing privileges.
Okay.
I see it.
All right. Let's see. I want to try to make one more adjustment. All right. Let's see.
When we get ready to start, Linda, I will turn the recording back on. Right now, I have it off.
Okay.
Okay. You can still hear me?
Yes.
Yes. You can see the screen. Okay.
Yes.
Okay.
Be back in a few minutes.
Hey, good evening, everybody.
Hi, Pastor. How are you?
Hey, I'm okay. I'm probably gonna have my camera off. I'm doing prep. I have a procedure tomorrow, so just FYI. I need
Right,
that
Pastor.
information, but I need to let you know why I'm off camera. Okay.
Okay. All
All
right.
right.
Pastor, before you go, I just want to introduce you to our speaker, Diana Edwards. And this is
Okay.
Pastor,
Hi, Diana. Thank you
Clark.
so much for being here and for doing this workshop. It is so needed, I do believe.
Well, we're excited to be here, and we're going to give out some good information. I think everyone will find helpful. So, thank you for having us.
Yeah. All right. Okay, and y'all gonna record it once it starts, right?
Yes, I told Linda I have it off right now, and I will turn it on once it gets started.
Okay, awesome.
Yeah.
All right.
I like her remarks. Relax and take a seat. We're here to help. We're here to help. Yes.
That is so wonderful.
Thank you.
I like that.
Thank you.
Because everybody gonna need a lot of help.
Well, oftentimes we find people who they come to us and they have questions, they're confused, they just so it's just let's just take a seat. Let's just start at the beginning, see where you are, and it'll all come together for you.
That's right.
Yes. Yes.
everyone. We got about 18 people on right now, and it's 6 o'clock, and we're going to give it just 1 or 2 more minutes, and then we're going to go ahead and get started. So just hold on, hold tight.
Recording in progress.
Hello, Miss Smith.
Hello, Roy. How are you?
Good. How are you, Roy?
I'm doing well. Good evening, everyone. Thank you all.
Good evening.
Good evening.
Good evening.
Good evening. Thank y'all all so much for coming out for the Medicare. We have a speaker, Diana Edwards from Medicare and Retirement, and she's going to speak to us about the changes for Medicare. So I don't want to take too much time. We're going to turn it over to Lanita. Lanita, are you on the line?
Linda, we would like.
Yes, can you hear me?
Yes, we would like Pastor to open with prayer.
Oh, okay. All right. Lanita, we're going to turn it over to Pastor so she can open up for prayer.
All right.
Okay. Pastor, are you on the line?
Hello.
Okay.
Remember, Pastor said that she was going to.
Okay. All right. So
okay, Rita, do the prayer.
I will open in prayer.
Okay. Rita's going to open up in prayer for us.
Our Father, which art in heaven, Lord, we come to you tonight with thanksgiving in our hearts and praise on our lips. Lord, we thank you for this session on tonight. Lord, we thank you for Diana, oh God, that did not think it was robbery for her to come and share information with your people. Lord, we are grateful. So, Lord, right now we ask that you bless the session, oh God. Bless our pastor, Lord, and bless everyone that's on this session for tonight. And it is our prayer on tonight that the information that will be provided to us, that we will use that information, oh God. So, Lord, we just thank you tonight. We praise you, we glorify you, and we just lift up your holy name. Thank you for Linda, God, who scheduled this, Lord. We thank you for her service to you, oh God. And we ask that you continue to bless her as she lead this ministry for you, God. So we're giving you honor and giving you praise. In the mighty name of Jesus, I say this prayer. Amen.
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 Okay. Diana, we're going to go ahead and turn it over to you.
Okay. All right. Good evening, everyone. How are you? So glad you're with us tonight. I just want to give honor to God and declare that He is in our midst and that He will bring clarity and understanding and all the information that you're seeking tonight. So because you knock, I believe you will receive the information regarding Medicare and that it will answer your questions and give you the right path for making the best decisions for yourself and your family. I want to give honor to the pastor of the church, Linda Smith. I see Retha and all of the leadership there at the church. We want to acknowledge you as well. On the screen, you'll see me and my husband, Zachariah. He is on the line with us, and he will chime in throughout the presentation. We're going to go through some slides. We're going to not spend as much time on some slides because this is we're going to be talking about some areas of Medicare that we may not dwell on tonight. But if you see something, you have questions, please, I invite your questions. This will be interactive. So let's just relax and have a seat. And we want you to know that we are here to help you.
Miss Diane, you're muted.
You didn't hear anything I said?
No, ma'am.
Oh my God, I was going to town. Okay, let me start all over again. So first of all, I just want to give honor and glory to God. I wanted to acknowledge the pastor of the church and all and Sister Lynn Smith and all the leadership there that has sponsored my husband and myself to be with you tonight. It is our prayer that you will get clarity, understanding, and wisdom that you're seeking as you give your time tonight to hear what we have to say. Our hearts are to give you the information, to try to make it simple. If there are any questions along the way, we'll take your questions along the way. This is going to be a pretty much interactive presentation. On the screen, you're going to see a picture of my husband and myself and Zachariah. We call him Zach, and he is going to chime in at some point, especially when we start talking about the Medicare drug plans. At the bottom of the screen, you'll see October 15th through December 7th for the annual enrollment. That's the season we're in now. And so we're going to talk about that. And then on the other side of the bottom of the screen, we want you to know that if you are leaving employer coverage or you're losing coverage, you have a special enrollment. So this season would not necessarily apply to you. This season is for people that are already on Medicare and looking to make changes to their Medicare, because there are some changes that you're going to need to know about your plan to see what you would do during this time. So that's where we are right now. So just want to know that the Medicare open annual enrollment is for people that may be on a prescription drug plan, a standalone drug plan, which are supplement, or for people that may be on a Medicare Advantage plan that has the drug plan included with it. All right, so without further ado, let's see if I can get you to the next screen. We're going to start by reading a disclosure that they want us to tell you that we do not offer every plan available to your area. Any information we provide is limited. These plans we do offer in your area, so please contact Medicare.gov or 1-800-MEDICARE to get additional information for your jurisdictions. However, you can also call us and we can give you guidance in that area as well. Let's see who we are. This is who we are. Diane and Zachariah Edwards. We are educators in the Chesterfield Adult Education Program, and we are considered local experts in the Medicare business because we've been doing this quite a while. We have been proudly assisting our community in planning for retirement for over a decade. And so we're here to help you tonight. And we're not just licensed in the state of Virginia. We are brokers. So we're not here to tell you just about one product, because that's all we have to bring to the table. We are going to bring lots of information, and you will be able to get what you need from what we're going to present tonight. We're not just licensed in Virginia, but North Carolina, Maryland, Alabama, and other states. As we go along, what sets us apart? Because I'm a certified senior advisor. I'm here to help seniors with all types of senior matters, not just Medicare. But we're also a certified financial fiduciary, which means we can help you if you're losing your employer coverage and you have a 401k or something like that that you need to roll over. We do that as well. We're AARP branded representatives, members of the Independent Insurance Agents of Virginia, Federal Employee Retirement Benefit Consultant, member of BBB, member of the American Association of Medicare Supplement Professionals and Long-Term Care Professionals. And again, in our local area here, we teach Medicare basics. We are known as your Medicare mechanics. So what happens if we can help you? Our services are free. We do not charge you anything for our services. If you call on us to help you, we're going to try to find a solution for whatever it is that you need. And once, if we're able to enroll you in your new plan or make any changes to your plan, if we're able to help you, then that's what we will do, and you will be on our book of business, and that help will continue not just at the enrollment time, but as long as you're part of our business, you're there. We're there. We just don't put you on the books and leave you. You can call us, as you may find that you might need to do as the year goes around. We represent multiple companies. As I said before, we're brokers, not just one company. Our service is 100% free to you, and you don't pay extra to work with us. We are independent Medicare agents, and we work for you, not the companies. So at the table today, here are some of the things that we offer. Today we're going to concentrate on Medicare, but we do have Medicare plans, Medicare for veterans, long-term care, life insurance, final expense, retirement coaching, rollovers of your 401k, 403b, federal employee benefits coaching for those retiring, funeral planning consultant, Delta Dental we offer, VSP we offer, cancer, heart attack, stroke insurance we offer, and hospital indemnity to help with your copays. Today's special at the table, we're going to talk about avoiding 800 numbers. Many of you tonight may have questions about those TV commercials with the 800 number. Should I call them, or who do I call? Annual notices of change. This is what we're going to really focus on. I want you to know what these notices are, when to expect them, and why they're so important, and especially important for the changes coming up in the following year. We want you to be mindful of Medicare scams, and many of us may be getting bombarded with calls, especially this time of year, for people that are saying that they are part of Medicare when they may not be. Or they could be marketing organizations, and they're not a scam, but they're here to change your plans, is what they want to do. Again, we want you to be mindful of the Medicare enrollment period that we are in now. It's the annual time. This happens every year. October 15th through December the 7th, people who are already on Medicare can make any changes to their plans. This does not apply to Medicare supplements. We're going to talk about the ABCDs of Medicare, because you want to know what you're doing. You want to know the basic part of Medicare, how they work, and what your role is to make sure you're getting the best of what you are in with Medicare. You want to make sure you choose the right supplemental and drug plans. We're going to talk a little bit about your drug plans, and that's where Zach may come in to give you a little information and answer your questions. We also will just touch maybe a sentence or two, because we do offer or talk about long-term care, Medicare for veterans, TRICARE, and the changes that are coming up in Medicare for 2026. Our goal here today is to support you, train you, and empower you. So it's so important when I say empower you. it's important that you understand the plan that you have. When you call in to make an appointment, the receptionist may say, well, what insurance do you have? You do not tell them I have Humana or United or Aetna. That is only giving them the name of the company. So you want to make sure that they bill you correctly. If you do not know the name of your plan, make sure you have your Medicare card in front of you, and the name of your plan will be right there. So that's one of the things I want you guys to zero in on. This screen is just if you have any questions, wait until the end, but don't wait until the end. Let's talk about it as we get through this. So Social Security and Medicare works hand in hand. A lot of people, when they're eligible for Medicare, usually they're 65. And a lot of them think that they have to also take their Social Security just because they're eligible for Medicare. But that is not the case. So with regard to Social Security, you know, the soonest you can take Social Security is going to be age 62, where you'll get about 75% of your benefit. Now, everybody is not the same, so please, the other point I want to say here to empower you is don't listen to the advice that you're getting from your co-workers or your friends or your families, because everybody's situation is different, and they may be giving you information based on their situation. It may not apply to you at all. So make sure that if you have questions, feel free to call us, reach out to us. We'll be here for you. This is what we do every day, all day. Some people have to take their insurance. They're in Social Security at 62. Their situation is different. I had talked to a friend not too long ago. She took hers at 62, where she didn't really need to do that. But she was told by friend, family, that that's what she should do. And her benefit is significantly reduced because her full retirement age actually has not even come yet. As you go down the chart, you can see in this case that you'll receive 100% of your Social Security benefit at age 62. So you want to at least wait until your full retirement age. So in your notes tonight, you can say Social Security, wait for full retirement age if possible. If you go beyond the full retirement age to age 70, that is when you max out, and that will be the largest amount of Social Security benefit that you can get. And you can see on this chart it talks about your age if you take Social Security at 62 and on up to 70. You can see how those amounts change, can't you? Is everybody on mute? Okay.
No, they're not. I do have a question from one of the participants. Some people have been receiving letters that says that the enrollment period has ended, and I just want to make sure if you can make sure it's clear. Your last slide did say that December the 7th is the last day of enrollment to make changes and everything.
So the period is started October 15th and it goes to December the 7th. But I do not want you to wait until December the 7th, because that's the deadline. But you want to make your changes way before then if you can.
And also, Diana, I sent you a list of questions from another participant. I emailed those questions to you.
I don't see them yet, but anyway,
Okay.
Email those. Do you have them? Do you have them also?
Yes, I do.
Okay. So as we go, we can talk about those questions as we go through this. If any of the questions pertain to anything so far, or you can just interject as we go.
No, I've already asked that one question that was on that other screen.
Okay.
Already cleared that up.
Okay. Very good, Linda. Thank you. This chart here allows you to see the year that you were born and what your full retirement benefit will be under Social Security. So the main thing I want you to take away from this screen is, if you can, you want to wait to get your Social Security at your full retirement age. That's what FRA, when you get 100% of the benefit. Okay, I'm just going to talk a little bit about what's called IRMA. It's a Medicare Income Related Monthly Adjustment Amount. That's a mouthful to say. But this is for people with high incomes. So we're going to look at a chart in a minute, but Medicare is going to charge you more if you're making more. IRMA is determined by income from your income tax return 2 years prior. This means that for your 2024 Medicare premiums, your 2022 income tax return is used. The income used to determine IRMA is a form of modified adjusted gross income, which is specific to Medicare. So let me show you. On this chart, we're talking about 2025, the IRMA here. The first two columns shows that if you're filing as a single person with your income, you can have up to $106,000 or less. Or if you're married and filing jointly, your maximum household income, adjusted gross income, would be $212,000, in which case you see in this column that there is no IRMA applied. So Medicare Part B is $185, and that was for this year. You can make a note in your notepad tonight that this amount will go up for 2025. It will go up to $206.50. This amount is taken directly out of your Social Security check if you're receiving Social Security benefits. If you are not and you're paying quarterly, just know that that amount is going to change. So they give you the quarterly amount. This adjustment also would pertain to your Part D or your drug plan. So since there is no IRMA in this illustration on the first line, there is no additional premiums. But if you take a look at the second line and the lines beyond, you can follow the concept. So if you're...
One questions. This is Roy.
Hi, Roy. Hi, Roy. What's your question?
The question is for the 185 that you just mentioned. That will come out if the participant or the beneficiary, the person receiving the Social Security, if they combined will make it more than 212,000 for that previous year.
So Medicare is going to treat everybody individual on your own Medicare plan. So if you are joint and you have 200 in your household income is 212,000 or less, then the amount that they will be taking out of each of your Social Security, if both of you are receiving Social Security, will be 185 for this year. In January, that amount goes to 206.50.
And that's if we're both receiving Social Security.
Yes, if one of you are not receiving Social Security, that means you're paying out of pocket quarterly. So you would pay the quarterly amount that out of your pocket for the Part B Medicare. Did I get your question answered? Okay, Roy?
I think so. I think you did.
Is there something you're not clear on?
Well, no, it's just that I'm inside of a gym right now. I'm just go outside this year. Hold on. Okay, so the thing that, because I just started receiving my Social Security, and I haven't seen anything taken out of it. And I'm wondering, is this something I should expect going forward?
So when did you start your Social Security? How long ago?
This month. I got my first check in November.
Okay, so November was your first Social Security check?
Yes.
Okay, and are you on Medicare, right?
I am.
Okay, so if it started this month, then you should see an adjustment in your monthly benefit that has been reduced by $185 because it pays for your Part B premium of Medicare.
I guess that's where my confusion is. Am I going to see that at the next check? Because so my check I got the full amount of the check that was
You
expected.
got the full amount? Okay, well, they will adjust that with the next payment if it did not come out. They're going to get this, the 185. So you will see an adjustment in your check, and if it didn't come out this time, you will see it in the next.
Okay, so I'm just have to keep an eye out. Thank you so much.
You're welcome. Okay, so I'm going to go to the second line and then we're going to move on. The second line just shows what happens when IRMA does apply to you. So if you're single and your income goes over the 106, like 106.01, up to 133,000, you're single and that's what your income is. Now you're kicking in IRMA. Now, if you're married, they're going to consider the household income. If it's over this 212, and it goes up to 266, then yes, IRMA is going to kick in at that point, and the monthly premium is not going to be the 185. It goes up to, they're going to charge you 259 for your Part B premium, and then if you go on over, it also is going to apply to your drug plan, Medicare Part D, in which case it will increase by $13.70. So that's just to show you if your income goes over a certain amount, what happens, how you're charged. Sometimes people take money out of their 401k and they add that to your income that day, so it may put you in a IRMA category for that time period, but then it will go back to the regular rate that it should be once that has been satisfied. So what happens if you get an IRMA increased amount on your Medicare and you want to challenge it? I just want to show this slide right here. You can go in and complete your form SSA-44 because there may be some life-changing events, marriage, divorce, death of a spouse, work stoppage, work reduction, whatever your case is, you want to present it on this form here and see if that will give you an option for that IRMA not to be applied to you. I'm not going to go into figuring IRMA. I'm going to get to what we are here for tonight is Medicare basics. So we want, it's really good when you understand the basics of your insurance. So Medicare has 4 parts, guys. They have 4 parts, A, B, C, and D. And we're going to look at each one of those, and we're going to see how they work and how you pay for each of those. And then we're going to talk about any questions. Any questions, Linda?
I do have one question the person has on A, B, and D, but I'm going to, once you go through here, maybe answer this question.
Okay.
How exactly is the proper coverage level determined for each beneficiary under Medicare Part A, B, and D? And then is there a formula or a standardized method to estimating the total out-of-pocket cost for 2026? And then they have, if 2 retirees have different monthly incomes, let's say $5 different, will Medicare premium different accordingly, or are they the same? Then they have Part B premium, this person got a lot of stuff. Part B premium are set. Let me just answer the first 2, and then we'll get to the next.
So, thank you so much. So let's just go. We may answer some of these as we go along. I will say that Medicare is going to consider the household income of the 2 individuals if they're filing together. They're going to look at your taxes and they're going to determine the whole outcome, the total outcome for that $212,000. So they're going to examine your tax return. So let me go on and we'll come back if that's not answered. So Medicare basics, there are 4 parts, A, B, C, and D. How you enroll in Part A and B, and what are parts C and D all about. Let's take a look. All right, so many of us are in this situation when you're turning 65. I don't know who's in our audience tonight. I don't know if there are those there that are already on Medicare. Maybe many of you are already on Medicare. Maybe some of you are turning 65. And if that's the case, we want to know who you are if you're turning 65 and how to go about enrolling in Medicare.
Diane, we have a mixed group.
Pardon me?
We have a mixed group.
Okay. So,
yeah.
Very, so we have a mixed group. Some people are turning 65. Then maybe somebody want to share. I can tell you what to do in that case. But, yeah, so let's see what we can come up with here. The first thing, this guy, poor guy, it's like a lot of people when they come to us, so confused. What is all of this stuff? What are these enrollment periods? What is a penalty? What is, you have a lot of questions. And because we're getting so much information from everywhere, we've been bombarded with commercials and we don't know what to think. But one thing you want to do is make sure that you get your information or get your questions answered by a professional so that you can get on the right path and make sure that you're doing what you need to do. You want to stop the madness because we here at Edwards Medicare and Retirement are here to help you. It's our goal. So we start by saying, look, let's keep it simple. There are 4 parts to Medicare, but before we get that, this slide here is telling you, don't call the 800 numbers. You want to call the 800 numbers because they're telling you things that you're interested in and you want to find out information. We encourage you to call local people that you know. Give us a call. That's what you want to do. The people on the other end of those calls, they're there to make a sale that may or may not be the best decision choice for you at that time. So here are your 4 parts of Medicare. Let's break them down and tell you how they apply to you. A and B, for people that are turning 65, you can either enroll in Medicare at that time, or if you are in employer coverage, you're getting insurance from your employer, you may not have to enroll in both of these. You can just enroll in Part A, which is hospital care, that has a 0 premium. If you are on employer coverage and you are satisfied with the cost and the coverage there, you do not have to apply for B at that time. A lot of people think they have to enroll in both, but it depends on your situation. That's why I say everybody is different. If you think of each of these alphabet letters as insurance policies, you know that you're going to have a premium on an insurance policy and you're going to have a deductible. So Part A is for inpatient hospital. They do not refer to observation. If the hospital puts you in there and they're going to keep you, then we just want to see what's going on. That's observation. It's not inpatient. So you must be admitted into the hospital as an inpatient for this benefit here. And the reason you receive this benefit oftentimes is that you worked and paid into the system. So it's a 0 premium for this policy. Part B of Medicare is for anything other than inpatient hospital. It's your doctors, it's your labs, it's emergency care, anything that is covered under Medicare. Medicare is going to pay what is medically necessary. That's why when you come off employer coverage, you're asking about, I want dental, I want vision, I want this. Medicare is going to pay for what is medically necessary. So it's not going to pay for your dental. It's not going to pay for your vision. But we'll talk about that later. It's just what is medically necessary. So these 2 parts of Medicare is called your original Medicare. And both of these together, you will get this on the red, white, and blue Medicare card. It will have your name, your Medicare number, and your effective date of when your coverage starts. And when you hand this card over to your provider, it's going to cover 80% of your hospital and 80% of your medical. You got 20% still out there, and that's what you want to know how to cover. So we're going to talk about that. I want to skip down to the next 2, which is Part C. And it's very important that you know that it's 2 names for Part C. It can either be Medicare Advantage or it could be Medicare Part C. It is the same thing. So some of the commercials in years past, they referred to it as Medicare Advantage, but now see a lot of the commercials are saying Medicare Part C because they really do want you to call the 800 number to find out, well, what's Part C? Part C and Medicare Advantage are the same thing. Part C, if you enroll in Part C, it's an insurance company who will manage your health care, and you will pay co-pays per visit. You will have networks, and your service area of coverage is going to be limited. So oftentimes in these plans, like you see on the TV, when they're offering you a lot of benefits like vision, dental, they may offer you over the counter, they may offer you groceries, utilities, all of that. They're insurance companies that are going to be managing your care. So this is often a form of managed care, and you want to make sure that you understand who's managing your care under Part C. Part D, of course, D stands for drugs. This is the Medicare drug plan. So the cost of your drug plan is going to be determined by the medications that you're on. So Medicare used to have about 26 drug companies in Virginia. Now it's about 9 coming up for the coming year. So I just want to let you know that that's your basics right here. Medicare, A, B, C, and D. Let me just clear something up. A and B is covering the 80%, and if you enroll in Part C, Medicare Advantage, it helps you out with the 20% left on the table because you're not paying the full 20%. You're going to be paying a copay for each Medicare covered service, and the drug plan is often included with your Medicare Advantage. Are there any questions?
Yeah, this is Valerie. Can you have A, B, and D without C?
Yes, but tell me what you think would be the disadvantage of not having C if you just go A, B, and D.
If you have other health insurance like TRICARE or BA or something like that.
Okay, so that's a very good question. So if you have TRICARE, that's a whole different animal. And we can get to that slide near the end, but let me just say, with TRICARE acts as a Medicare supplement. So you have to be enrolled in A and B for TRICARE for Life, and then your TRICARE for Life will act as your supplement to pick up the 20%. It will also have your drug plan, and it may have some dental in it too. So if you have TRICARE for Life, is a little bit different than what I'm showing you right here. Did that answer your question?
Yes, ma'am.
Thank you. Okay, so again, we're talking about the first 2 parts of Medicare, which is called your original Medicare, and this covers 80%. So you can
ask a question? If you do wrong again. If you have, just say with a TRICARE thing, do you need to have Part B at all?
Yes, you do. You must be enrolled in A and B in order to get your TRICARE for Life.
But they will be charging you the $212 plus for Part D, right? Or they'll be charging you for Part D.
They'll be charging you for the premium on Part B, which next year is $206.50. It will come out of your Social Security check if you're receiving Social Security benefits.
That will be for both, for all participants. Like, say me and my wife are both receiving Social Security.
Yeah, so each of you will pay
that. It'll be $206 or basically $412 a month.
Yes. There will be each individual policy. Each of you will pay that amount. But you must be enrolled in Part A and B, and then your TRICARE will kick in as your supplement. Is that okay?
Okay.
This is Rita. Can I ask you to explain the Medicare Advantage with the service areas being limited?
So if you've seen on the commercials, this may be what you can relate to. It will tell us, they want you to tell the zip code you're in or tell the counties, because these plans are offered for specific locations. So if you give us your zip code, then it will tell us what plans are available in that area. So these are advantage plans that are restricted to certain areas. That's your service area. And so if you went outside of your service area, then you would only be covered for emergency services. So you're limited on your Medicare Advantage, which is also called Part C, is managed care. These are restricted, so you must know that when you get one of these plans, you got to say who your doctors are. So that's the first thing we do in considering Medicare Advantage. We're going to find out, well, who are your doctors? So we're going to try to find all the doctors that are in your area in order for you to get the best plan, because you get a Medicare Advantage plan, you want to be able to see your doctors. So that's how you decide which Medicare Advantage plan you should get. You don't decide on it by the price or by benefits in the plan. You want to make sure once you get the plan that you're able to see your doctors.
What about if you are traveling? How would that Medicare Advantage work? If there is an emergency, do you need to get approval before you see a doctor? Or if you're traveling and you have a medical emergency, how would the Medicare Advantage work?
That's a very good question. And I want to make it real clear, whether you're on a Medicare Advantage or if you're on the supplement, Medicare is always going to cover you for emergency. So even though you have networks and everything in your local area, if you're visiting relatives in another state, then you would receive care at an emergency, and that will be covered.
Do you need to get their approval before?
No, you don't. You just, emergency are considered life-threatening events. You get to the closest hospital, and they will honor that emergency coverage. All right, so we talked about Part A and B covering the 80%.
Excuse me, Diana. We have a few questions in the chat. One of them was, what is the advantage of having C if you have D? And then we have, should we continue private insurance along with Medicare A and B? And then we have another person, what is the bronze plan?
The bronze plan does not. The bronze plan does not pertain to Medicare. That will be for a person maybe on ACA, also known as Obamacare. People that are under 65, they have those metal tiers like bronze, gold, and silver. I think that's what he must be referring to. One of the other questions was about what was the other one about Medicare Part C or something?
Yeah. What is the advantage of having C if you have D?
So let's go back to the basics. You got to have A and B that covers 80%. So when you enroll in a Medicare Advantage, this screen is a good illustration. So you already have your A and B. You got the red, white, and blue card. You got your 80% coverage. Now your decision is, am I going to enroll in an Advantage plan or a supplement plan to help me with that 20% that's on the table, because Medicare gives you two options. So if you have A and B and you say, well, I'm going to enroll in a Medicare Advantage plan, also known as Medicare Part C, also known as managed care. I'm going to find my doctors. I know that this is also going to include my drug plan. And oftentimes these plans may, depending on the area you live in, may be a zero premium or a very low premium. That is the nature of Medicare Advantage plans offered by insurance companies. So if you do that, you're going to be reducing the 20%, because now you're not going to pay 20%, you're going to pay copays. You're going to pay copays for every Medicare covered service. If you go to the doctor, if you go to use an ambulance, an emergency room, you got labs, you got MRIs. Every time you have a Medicare covered service, you're going to pull out a copay at the time of service. Most of the time, Except maybe if you're in the hospital, those co-pays may run $300 to $400 a day, but they will bill you. But you will not be paying 20% of a hospital bill. You're going to be paying co-pays up to a certain amount of days that you're in there.
Okay. Diana, I think the person now says that they meant, what is the advantage of having supplemental? They meant C to be supplemental, and if you have D.
D is your drug plan. Zach, you want to say something?
Yeah. Hi, everybody.
This is my husband, Zach. You saw his picture on
I hear you.
Okay. All right. Let me see if we could kind of back up here a little bit. What's I think the question was, what was the advantage of having D if you've got a supplement? Was that the question?
Yes. What's the advantage of having, I guess they meant a supplement if you have D? That was one.
Well, first of all, you got to understand the 4 parts. The 4 parts is A and B. That's the stationary bike of your Medicare, no matter what. All right. Part D is strictly for drugs. So if you've got A and B and you've got D, like Diana said, who's going to pay the 20% cost that you owe the hospital? So you only have 2 ways of doing that. Is through the Medicare Advantage plan, whereas that the Humana or AARP make a contract with Medicare, says, give me your Medicare beneficiary and I will cover their medical costs just like you cover it, along with the Part D in that Medicare Advantage or Part C plan. So the advantage of it is covering your medical and the Part D in that Part C. Now, if you did not want that Medicare Advantage plan, because believe me, the insurance company is managing your health and you don't get what you think you're going to get, then you best stay with the original Medicare, Parts A and B. Let Medicare pay that 80%, and then you buy a supplement or Medigap policy as an additional, where you're going to pay a monthly premium to pick up that whole 20%, and then you also get a separate drug plan. So you got A and B, a Medicare supplement, and a drug plan when you deal with that. Those are the only 2 options or 2 ways that you can get your Medicare. I think it's just a little confusion there on that question. But it's that one thing, that Part D better be there. If it's not, Medicare is going to penalize you for life.
Linda, can you find out if we answered that question?
The person who, I don't want to call
excuse me. I have a question. I mean, no, I didn't word it right. Okay, so I do have the supplemental, but you're talking about the advantage. So if you have the advantage, it's limited. I mean, yes, I have a supplemental, which is what, considered C, correct? I have C and D. Plus I have the A and B. But all
right, so let's see, if you say supplement, then we think you're talking over here. But if you have a Medicare Advantage, we usually refer to that, so you don't confuse, because we're thinking we're not sure which you have. So it sounds like you have a Medicare Advantage plan with the drug plan included. And when you go to your doctors, you have to have network doctors and you pay co-pays. Is that how your insurance works?
No, I mean, I have a D plan for my drugs, and then I have a supplemental also that I actually ended up getting through my company because they had a good premium. This advantage, I wasn't even looking at that.
I mean, I didn't think that, is that considered, the advantage? Because I thought it was just supplemental. So I have a supplemental
Yes,
through my company.
you have a supplement along with the drug plan.
Yes.
The left side.
Right. Okay.
So you want to stay on the left side.
That's what I thought. Yeah, I just want to stay there. You're talking about the advantages.
Don't come to the right side if you've got a supplemental drug plan. You are fine.
Well, that's what I thought. I just didn't word it right, but I think, yeah, I'm fine. Yeah, sorry about that. Thank you.
Okay, that's okay. So in this part of the presentation, that's where we were getting at. And this screen is basically showing you, because we talked earlier about A and B covering 80%, and then the 20%. It's all about the 20%. Will you get the 20% covered through a Medicare Advantage? So we were discussing this right here, and then we're going to go to the supplement. But those of you who are on a Medicare supplement, if you look on your card, it will say Medicare Supplement Plan G, F, or something. So if you look on your card and you see that you have a supplement, you know what you have. So when someone asks you what your insurance is, look on the card and tell them what you have. Don't just give them the name of the company, because that's going to be your medical, and this allows you to go to any doctor. We haven't gotten to this part yet, but unlike Medicare Advantage, where you have to stay in your networks, with the supplement, you can go to any Medicare doctor anywhere in the whole United States, as long as they accept Medicare. Medicare will be considered your primary care insurance, and your supplement is your secondary. So you will always show both cards, or make sure they have both of your insurances on file so they can file your claim with both companies. Now, if you have a Plan G supplement, you will meet your deductible for the year, and then everything else for the remainder of the year is going to cover that 20% that's on the table. So Medicare Advantage is going to cover the 20% by requiring that you pay copays, small copays along the way. Over here, your health over here is covered by your doctor. Insurance do not get involved over here. So if your doctor says you need to have surgery, then Medicare says it's medically necessary, so you're going to have it. You're going to be covered at 80%. Your supplement is going to pick up the other 20% once you meet the deductible. And for 2026, that deductible is going to be $288 for the year. And then you have your drug plan.
Let me speak a little bit while we got that screen up, Diana.
Okay.
It's important that folks understand that in 2026, it's a lot of changes with Medicare Advantage and drug plans. There are a lot of problems all over the country where the insurance companies cannot reach contractual financial agreements with doctors, hospitals, facilities. So there's a problem that's going on there because it's all about money. Medicare Advantage, if you notice, that's all you see on TV. You don't see anything hardly about Medicare Supplement. Medicare Advantage is the money maker for the insurance company. So, for instance, just Saturday we did a meeting like this for Chantilly. And it was one gentleman there that had a Medicare Advantage plan. He lost all of his doctors. None of his doctors was going to be in the network of his plan for 2026. And he has a lot of medical conditions. So we scrambled trying to find him a new plan for his doctors. So you have to be very careful with the Medicare Advantage plans, and you have to look at that annual notice of change that I know Diana's going to get to, that they send out at the end of September telling you of all the changes of those plans and your drug plans. So it's you need to understand what you're buying. You can't buy based on premium or what my brother have or my wife have or my neighbor have. You've got to look at your own individual self on these plans.
This is Retha. While we're on the screen, I would just like to talk about, let's say, and I'm just going to use myself as an example. I have Medicare Part A and B. I am retired from the federal service, so I have a federal health plan. That is my supplement. I have a low option plan from the federal employee health benefit plan. So that's my supplement. I have Medicare A and B. I have the federal health plan as my supplement. Under my federal health plan, I have a drug plan. So I don't have Part D. So what I have, the supplement can be TRICARE from those persons that are retired from the military. So if they have A and B, then they have TRICARE. I have A and B, and then I have a federal health plan. My federal health plan have drugs. So that is, I wanted to be clear that they understand that if your employer, if you are retired and your employer, you have your employer insurance, that can be your supplement to the aids.
It can be, but you have to understand something. The federal government is totally different than an independent company
right.
Retired from. With the federal government and you're dealing with TRICARE and all of these type things, you're basically fine. It's totally different. But if you worked for John Doe Corporation, it's totally different. So you have to really look at what you have under that retirement plan they are offering you, because again, under those plans, the employer can control your retirement benefits of insurance.
Yes.
So you have to look at all of that, but totally understandable. You're right. You're fine. Anybody that basically retired from the government, they have TRICARE and all of these different things. You're pretty much okay. But
the Advantage plan is not good for me.
Not for you, no.
But it might be for somebody else.
Exactly. Right. Exactly.
So these slides are pretty much for the person that does not have the same coverage you do, or maybe on they may be on the TRICARE for Life or something else. But that's why I want the people to participate if they are have questions or whatever, because this is your average way that the average person would make a choice as to supplementing that 20%. So, Retha, you're good.
Okay, we do have another question. Should we continue private insurance along with Medicare A and B? And then there was another one. What is the
let me do one by one, because I can't keep up with it.
Oh, okay. Should we continue private insurance along with Medicare A and B?
When they say private insurance, they have insurance coverage through their job?
Let's say something like Blue Cross Blue Shield. I'm assuming that's what they mean.
We got well, if they have employees,
it's my question. I agree. I have insurance to the federal government, so I'm getting ready to retire, and I can carry continue my private insurance.
So if you have federal insurance that you can take into retirement,
yes,
and okay, so you have your drug plan that's included, you have your medical that's included.
Yes.
Okay.
She like me.
I'm like
it sounds like the same situation.
Yes.
Well, to me, you would want to probably keep that federal coverage.
Yeah.
You probably are going to be better off keeping your federal coverage than getting a individual Medicare supplement drug plan or going to a Medicare Advantage plan. You'll be better off keeping your federal coverage.
But go to a low
Yeah, just you could just send that. Okay.
And we have another one. What is the penalty for joining now?
What is the what?
What is the penalty for joining now? If they was, let's say, a person had 65 and they didn't sign up for Medicare, and now they want to join. They're probably about 70, 69, or 70 years old.
I don't know how they determine the penalty, but if they, Zach, you can chime in.
The penalty, first of all, Medicare require if they enrolled in Part A and Part B, there's no penalty on Part B. But if they only enrolled, let's say, in Part A, then Medicare would determine the penalty for their Part B based on income and that type thing between that time that they didn't between 65 and the time that they want to enroll.
So, Linda, let me ask you a question, or ask that person a question. They did not enroll because they had coverage through their employer, or did they go for a time with no insurance? That's the only time you're going to get a penalty, is if you did not enroll when you were eligible to enroll.
I believe that person didn't enroll when they were eligible.
Did not have any insurance?
I think they already had insurance. If that person is on, they can go ahead and answer for themselves. I believe that person that had that question, they had insurance under their wife, and they did not enroll in Medicare.
Okay.
And then, go ahead.
As long as they had insurance when they turned 65, if they had credible coverage from an employer, no matter whether it was their own or up under their wife's plan, as long as they had credible coverage and drug coverage, there's no penalty as long as they did not go 63 days or more without coverage from the time that they're coming off of those plans. So if he or she is 65 and they wanted to remain on their wife's coverage or their own coverage, and they worked until they were 68 years old, if they come off of that plan at that time, there's no penalty as long as they get their new coverage within 63 days after it ended.
Okay. And now we have another question. I'm caring for my 95-year-old grandmother, and she has A and B and C. Also, AARP supplemental plan.
I'm sorry, there's an interruption here.
Oh, I'm sorry. Sorry about that.
Okay. All right, Linda. Someone is caring for their 95-year-old grandmother.
And then we'll get back to that person. Hold on. I'm caring for my 95-year-old grandmother, and she has Part A, B, and D. Also, AARP supplemental plan through United Healthcare. Sounds like she should keep her insurance as is and not to change it and pick up Part C Medicare Advantage.
Oh gosh, no.
No. You either do one or the other. She's in the best situation. The 95-year-old, she needs to be where she is and stay where she is. She does not. You don't get both of these. It's either or. So that's what we're trying to say. So she has made her choice, and it's an excellent choice. The Medicare supplements, they go up every year, and they're going to go up in 2006. 2026 is what we want to say tonight about what's going on with these insurances. But they're going to cover her, like I said before. She can go to any doctor. She doesn't have to be in any service area or paying co-pays or find out your doctor that left the network and you're receiving care. She doesn't have to worry about any of that. And at her age, this is the best possible thing that she has. Do not even think about changing over to Medicare Advantage for her. That will be horrible. She needs every year, though, this drug plan changed. So remember I told you we're in the annual election period for Medicare, and people who are on drug plans, this is called a standalone drug plan because you're adding it to the supplement. Over here, the drug plan is included. But every year you want to check to see what changes are in your drug plan over here or your Medicare Advantage plan. I want to make sure this young lady who's caring for her 95-year-old grandma to know that she's fine. She just needs to review her drug plan for next year, and then I want to talk about that. Is she clear on that?
I believe she just wrote something. My grandmother also had Part F as secondary for hospital stay. So are you on the line if you're clear on that? I believe
I think she has a Medicare supplement plan now, is what she said.
Can you hear me?
Yes, I can hear you.
Hey, Linda. This is Yolanda. How are you? I'm Linda's cousin. So yes, I am very clear. I'm just new to this. We're taking care of my grandmother, and I'm just got so confused with all of these plans she has. I didn't know if she was in her best situation. So thank you for clarifying that. Yes, she is.
Yes, she is.
Okay.
Yes, she is.
And I didn't understand about the Part F because I know you didn't mention Part F. So
it's not a Part F. It's a Medicare supplement Plan F.
Okay, Plan F. Okay.
Yes. It's a Plan F, and that's what's confusing because all of these, all of these alphabets and everything. We haven't even gotten to the supplement scale, and I know it's 7:00, Linda. But if you're okay, I'm okay. You let me know.
Yeah, we can go a little bit longer until.
Okay, because it's very important. I just got into the Medicare Advantage, but guys, everybody, listen to this. Zach told you, every year we as Medicare beneficiaries get what's called an annual notice of change. We call it ANOC. Your insurance company is going to send you a notification in September, every September, if you are on a plan to tell you what your changes are going to be in that plan for next year. So I want to know if everybody in the audience have received their notice of change, or do they know? How many don't know if they received it? This is very important for this coming year because it's so many things that are happening. For instance, those of you who are on Medicare Advantage plans, millions of people are losing their plans. Those people that are on PPOs. United Healthcare alone is dropping 600,000 members from PPO plans. Your annual notice of change will tell you if that's your case. If you have a PPO plan, or if you don't know, pull out your card now, look at your card, and see if you have an Advantage Plan PPO. Because if you do, you should have gotten, or your annual notice of change will tell you that that plan is leaving the marketplace for 2026. If you ignore this change or you don't address it, you're going to end up with no insurance next year because you didn't do anything about it. Those of you who are on Aetna, a lot of their PPO plans are leaving the market next year. Pull out your card. Your PPOs would apply if you have a Medicare Advantage. It does not apply to the Medicare supplement like Yolanda's grandma had. We're talking about these plans over here. They're either an HMO or a PPO. A lot of companies will send you out, well, all the companies are going to send out that annual notice of change. Please look at yours, look at your card. If it says PPO, go back and look at your annual notice of change. If you can't find it, you need to call the company and tell them to send it to you. We don't have a lot of time left with this, getting this corrected, because if you don't do it by the end date of the 7th of December, you're going to end up with no insurance for next year, and that is going to be horrible. So that's one of the things. Now, for the people that are on Medicare Advantage for next year, we're talking now about the changes. A lot of the insurance company wants to make sure that their profit margins are growing. So a lot of the benefits that you may have gotten this year, it may not be on the books for next year. So you're going to have fewer networks in some cases. You're going to pay higher co-pays in some cases. Your drug tiers are going to change, and some drugs will not be offered at all. All of this is in your annual notice of change, everybody. You need to take that apart and look at it. And if you don't understand it, you need to call us. The other is for Part D. Those who are on a standalone Part D, there are going to be increases in your premium for standalone drug plans. That hasn't happened. Like, it could be up to $50 next year added onto your drug plan. The Medicare supplements, what's going to happen next year? You're going to see significant increase in the premiums for these plans. So it's a lot of increases, a lot of changes that are going to be happening in the Medicare world for next year. So I'm so glad you're here tonight, because this is critical, and we need to know this. This slide here, we're just moving on to Medicare supplement. We talked about the Medicare Advantage. We talked about, it's also called Medicare Advantage C, and it's managed care. That's one of the ways that you can help with the 80%. If you enroll in one of those plans, they are very low cost premiums. Some of them are zero premiums. That works for some people, as long as you understand how your insurance works with those. Your supplement is the other change. Like Yolanda's grandmother, her 95-year-old grandmother, this is what she chose to enroll in. So her original Medicare is going to cover that 80%, and she has Plan F, which is going to pick up the entire 20% of any medical or hospital bill. What does that mean for Yolanda's grandma? She's not going to get any medical bills. Why? Because A and B is picking up 80%, and her supplement Plan F is picking up the other 20%, and she does not get a bill. Medicare supplement plans is like a healthcare buffet. It covers what your Medicare A and B won't cover. So if your Medicare A and B is going to cover it because it's medically necessary, your supplement is going to cover it. If your Medicare A and B don't cover it, your supplement is not going to cover it. So that's what I wanted to say about the other choice you have, which is a Medicare supplement, also known as Medigap. You choose your doctors. There are no networks. You have the freedom to choose doctors and hospitals. You don't have to have any referrals to see specialists. You have these policies are automatically going to renew every year. As long as the premiums are paid, your coverage will continue. So you're going to avoid unexpected out-of-pocket medical costs throughout the year.
Excuse me, Diana. We have another question. If I have a federal government health plan and an HMO, do I need to have the Advantage plan?
No.
If you have an HMO, it sounds like it's an Advantage plan. That terminology is only used with Advantage plans, or if it's your government insurance, it's going to have to do with co-pays. So if that plan is an HMO, it sounds like that person is operating within networks. They can only go to network doctors in that network or facilities in that network and pay co-pays if they're referring to HMO, as much as I can understand from that question.
So will they need to have an Advantage plan too as well?
No.
No.
Oh, okay.
Oh, no.
All right.
That person is like me.
Yeah.
Not exactly. Not exactly.
Well, they have to stay within that HMO for the federal plan. I don't.
Right. So if we look at the two routes, you have equivalent of the Medicare supplement route. She has the equivalent of the Advantage route, and covering the 20%, and the federal government is sponsoring that. She has her coverage through both of you have your coverage through the federal government.
There was another question. Should we continue private insurance along with Medicare A and B?
You always got to have A and B, or you have nothing. A and B is your foundation. If you do not have any other coverage for Part B, unless you're working on a job and you have credible coverage through your employer, you do not need to enroll in Part B.
But that wasn't the question. Should she continue their private insurance with A and B? Yes.
You always got to have A and B.
A supplemental question pertains to A and B. Again, like for those who have the government insurance, this is Lloyd, by the way. Those who have the government insurance, does that include family protection? Like I'm a government spouse. Does that carry over for me also?
Only if she elected it.
If she elected it, yes.
Yeah. If she elected it, yeah, she can. That would transfer for you when she retires if she elect to carry you.
Yeah. Okay. Thank you.
Oh, and then there was one more. The person named Gallery, you had a question. You still have a question?
Who's that, Valerie?
Gallery.
Someone had Gallery. It was Gallery. Their name Gallery. GALAXY space tab. I think they're on mute right now.
Okay.
We'll just come back to them if they have a question.
Okay. So you see here, we're talking about Advantage again. That's where you see your networks, HMO or PPO. You're going to see those only if it's a Medicare Advantage. Okay. Dental, vision, or hearing are additional benefits that you can get with a Medicare Advantage plan. They're not extensive coverage, but they may have some very basic dental cleaning and vision. Like eye exams, you get so many, you get an eye exam every year, and you may have some other coverage, but you'd have to see what that particular Advantage company is offering you. Zach, are you back at your desk?
Yes.
Do you want to take over? How are we looking on questions, Linda?
We just have one more at the bottom. This person has, what about special needs C, and they got SNP. I'm not sure what SNP is.
SNP is chronic care. What is it? Special. Let's see.
Special needs. They are special needs plans, and the special needs plans are either for people that's on Medicare and Medicaid, or chronic conditions like heart, lungs, diabetes, that type of is called chronic SNPs, SNPs. So they are special Medicare Advantage plans for those people that might have those chronic conditions. Where they have it's more catered to, their co-pays and different things are catered to the specifics of the chronic condition. Whereas that if you're on a dual plan, what they call it, where you see on TV, they say Medicare and Medicaid, those are called dual special needs plans. And basically, if you're on Medicaid, you're below the poverty level. So just about all of your co-pays and everything that you do at the doctors are zero co-pays along with your medications, which is basically everything outside of A and B is picked up by the state of Virginia or Maryland or whatever like that.
Okay, what does she want to know about the special needs plan? The chronic special needs plan.
The person wasn't clear. They just said, "What about special needs CSNP?" But you probably have answered that. But we have another one that just came in. Can you ask them if a person just have A and B, but on my health insurance have PPO? What will I do? I'm with United Health Dual Plan. I have SNP and United Health.
Did she say dual plan?
Yes.
All right, that's a special needs plan. The biggest thing that she want to do is to make sure that her doctors are still in that network of that PPO. That's the biggest thing. But for her, if she's got a dual, she's pretty much okay as long as her doctors is still accepting that plan and the hospitals.
Linda, I have a question. I've been listening. If y'all don't mind, it's probably an odd question. My husband and I are on. We have Kaiser, so of course we only go there. They did change it. We did read through the changes. We used to pay zero premium. Now it's 38. So we chose that plan. It was similar. But my question is kind of different in the sense that we went on and renewed it. But looking at all the information you all gave us, once you renew it and it's still open enrollment, could you make a change? Like I was interested in maybe looking into the Medicare supplement as opposed to the Advantage. I'm not sure what works for me. That's a little bit more homework. So once you make your plan choice, are you allowed to go in and change it before December the 7th or no?
Yes.
So the whole purpose of this enrollment season is if you're on a Medicare Advantage, which that's what Kaiser is, it sounds like. Yes. Or a standalone drug plan. That's what this season is for, you to examine what your options are. And if you find a better option, sure, this is the time to change. No, what I mean is we already enrolled in their new plan for 2026. But this is before I learned from you all about the Medigap. Maybe I might wanted to look into that after I enrolled in it for 2026. Can you change it, or once you made that enrollment for 2026, you can't?
Yes, you can change multiple times during the annual election.
Okay, that's my question.
If you went with Kaiser and you found a plan that was better for you and your husband, and you wanted to change it, you could change it, and it would kick the Kaiser out. It would automatically kick it out.
Okay.
However, if you're looking to bear in mind, don't do anything to that plan until if you're looking at going trying to get a Medicare supplement. The supplement is going to underwrite you based on your health.
Okay, we can forget that then.
They're going to after that's another thing that you want to everybody want to remember. If you're on a Medicare Advantage plan and you want to go to a supplement, anytime after 6 months that you've been into that, after you've passed your 65th birthday or enrolled in Part B, a supplement is going to be underwritten, and it's going to be underwritten on your health, and you'll either get it or not, or the premium could double.
Well, we'll stay where I'm at. I'm the one with the chronic problem, so we're going to stay right where we at. And I'll add a footnote to that. Remember, I told you that a lot of plans are leaving the industry. Remember, I said this, that United Healthcare, they're eliminated. So if someone is on a plan that's being eliminated, they will get a letter from that company saying that your plan is not going to be here next year. If that happens, they can actually get into a supplement if they want to without any underwriting if your plan is leaving the area. Okay. And that's what we was thinking of choosing. United Healthcare was offered last year. When we looked it up this year in our zip code, United Healthcare is not even offering it in our zip code. So Kaiser was still the one offering, but just with a slightly higher premium to what we had. So we just switched to that, and everything works, and I guess we'll just keep on trucking. Thank you so much for the helpful information y'all given. Well, thank you, Linda. You're welcome.
Okay, we have another question real quick. Is the 2500 RX still the same before 100%?
I didn't understand.
What was it?
Person says, is the 2500 RX still the same before 100%?
Oh, what you're talking about is the cap. For 2025, the co-pays, deductibles, and everything in 2025, the cap is $2,000. And then all of your drugs are zero. In 2021, in 2026, the cap is going up to 2,100. So after you've paid the 2,100 in co-pays and that type deductible, then the drugs will be zero. So it's 2,100 for 2026. That's the cap.
Did that answer the question? Because so this year, I'll just use myself. I had drugs, and the 2,100 is not necessarily coming all out of my pocket. As if your copay plus what the insurance company pays for that drug, when the total hits this year 2,000, then you will not pay anything else for your drugs. So mine hit at 2,000 in June. So from June until the end of the year, I paid zero for my drugs. Next year, it will be $2,100 is the cap. And I hope that answers that person's question. Let's find out if it does.
Okay, and then there's another one. Do you call your doctor or your medical advantage plan to find out if your doctor is still in the network?
Call your advantage plan. Because if you call the doctor's office, you might get a 22-year-old that just started yesterday and they don't know anything. So call your advantage plan, the number on the back of the card, and they will tell you whether your doctor is in the network or not.
That's a good question.
Mm-hmm.
Is there anybody on the line, or excuse me, anybody in the audience here who has a PPO plan? And anybody know if they have a PPO plan? Have you had a chance to look at your cards your Medicare cards?
The Medicare health card, not the Medicare
that
card.
have dialed in, if you can just speak up if you have a PPO.
Yeah, we want to hear from you.
I have the special needs plan, but I do not have dual. Is there a supplement plan that I can get also?
No.
No,
you have an advantage plan, and your co-pays are going to be a little bit lower because of the chronic condition. So there's a special plan that they designed for people with chronic conditions, and that's your Medicare Advantage. So you can't have the Advantage and the supplement. You're good where you are.
I wanted a little help with that $2,000.
So if you look up, go ahead.
That would not. The supplement would not help you on the drugs. The supplement is for medical only. The help that's going to come with that Part D drugs on that $2,000 is only going to be if you get extra help from the state or on Medicaid.
I applied to it. I haven't heard from them yet.
Right. That's the only way you're going to get help on that.
Well, follow up on that, because extra help will be a great assistance to you with the cost of those drugs. So hopefully, if you haven't heard from them in a while, give them a call and stay on them until you get your answer, because that will mean a lot to you. I know.
Yeah.
Yes.
Okay. So
I'm grateful that I made the right decision in my insurance.
I'm glad you did too. Congratulations. That was very good. Very good. This slide here just basically is comparing the supplement. This is supplement G. We talked about it earlier versus the Medicare Advantage, and you can see the cost difference. This is pretty much what we were talking about here. I'm not going to get into that. I'm just going to see, are there any other questions as we go along here? Zach, did you have anything else you needed to add?
About the drugs?
Yeah, I think we kind of covered that.
Well, let me just make a couple points on the prescription drugs Part D. If anyone have not read their annual notice of change and they have Anthem, an Anthem standalone drug plan that goes with that supplement or whatever. Anthem is no longer providing drug coverage in Virginia on a standalone drug plan. So if you have Anthem or know someone that has Anthem, they need to get a new drug plan before December the 7th. On most, excuse me, most drug plans, the deductible has changed from the $590 in 2025 to $615 in 2026. They also have changed a lot of your medications depending on the company. If some of your drugs might have been on lower tier 1 or tier 2 medications, they have changed them to maybe a tier 3, which you might be paying 20% of the retail cost of the drug until you hit that until you hit that 2,000. So it's very important for anyone that especially have a standalone drug plan to either call your agent or somebody to check your medications. It's very important because they are not covered the same way they were in 2025. The copays are different. The monthly premium is different. Everything is different. Some drugstores, CVS, might have been preferred this year. Next year, they are not. So it's important to check that drug plan.
Well, the September letter that you said, will that be when you log in? Can you see that information when you log in?
You should be able to, if you have logged into that particular drug plan, you should be able to find the annual notice of change on that portal.
And if you don't, you can tell the company to send it to you, or you can, I don't know if they will give you any of the changes in the letter or whatever, but if you don't have it, please try to get a hold of it. It's very important for next year. It could make a difference in your health care for next year.
Especially the people on Anthem, because if they don't, Anthem clearly stated in their annual notice of change they won't provide coverage in 2026. So the people that don't read that information, they, go along just like they think it's always been. When January 1 comes, not only are they not going to get any help with paying for their drugs, they cannot get a new plan until next October. So therefore, Medicare is going to put a lifelong penalty against them.
Okay. All right, guys. How are we doing? Any other questions at this point, Linda?
No, I don't see any questions at this time.
Okay.
Oh, we do have one. Do you call your doctor or your medical advantage plan to find out if you're? Oh, we already answered that one. Okay.
Yeah, we got that one answered. So the main thing we want you to know is Medicare is not a one-size-fits-all. Doesn't mean that because this plan is working for John, it doesn't mean that it's going to work for Bob. Everybody's situation is different. That's the point we want to drive home. So please contact somebody who is going to be able to help you. You can call us. You can call your agent. Call somebody. When do you sign up? We have a variety, you say, of situations in the audience tonight. So if you're turning 65, you are not receiving Social Security, then you have to enroll in Social Security. So you can do that 3 months prior to your birthday. You can do it your birthday month, and you can do it up to 3 months after your birthday. But we recommend that if your birthday month is here, go ahead and get it done in your 3 months prior to your birthday, and the effective date will be you know, that would be the first day of the month of your birthday. Any questions? Do you understand when to sign up? Now, if you are not receiving Social Security, you have to enroll. If you are receiving Social Security and you're 65, they're automatically going to send you a Medicare A and B card. If you receive a Medicare A and B card and you're still working and have your employer coverage, you can send back the card and let them know you only want the Part A because you have credible coverage through your employer. Any questions on that? Okay. So
I have one question.
Yes.
So I'll be 65 in April, but due to my husband's death, I receive Social Security through death benefits.
Mhm.
I'm also in TRICARE. So will I automatically be enrolled because I'm receiving his death benefits, his Social Security death benefits?
Yes, as long as you're receiving any type of government benefit, whether it's regular Social Security, disability, survivors benefits, you are automatically enrolled. And if your birthday is in April, Zach, what would that be? January?
I would start looking for my card in the mail in January, and if you haven't received it by February, call Medicare and make sure that they, didn't slip you by.
Okay.
But that's a good question, Robin. It was a very good question.
Yep. And if you've got TRICARE and they're gonna continue it, you'll be fine with your TRICARE.
Yeah, absolutely. Yeah. Okay.
Good question. Thank you for participating.
Sure. Thank you.
Okay, so you have another question? I have Plan F, but when you put example up with you had Plan G. Is there a time when you should consider changing your plan? Is one plan better than the other?
I'll answer it, and I'm sure, well, Zach will answer it too, probably. Here's my spin on it. I wish I could put my hands readily on the chart. So in Virginia, you have Medicare plan. I don't want to confuse anybody, but it is confusing. We talked about the ABCs of Medicare, your basic Medicare, but when you talk about Medicare supplements, they have ABCs too. So you have, I think you have Medicare supplement A, B, you got G, K, L, M, and F, and C. You got all of those, right? So each one of those, by enrolling in any of those, you're going to make a premium based on that 20%. How much of that 20% is being covered? So people that are eligible for Plan F, which is the most expensive, just like Yolanda's grandma, her 95-year-old grandma, she said she found out that she had F. Well, remember I told you when I spoke to that she's not going to have any bill because F is going to take care of a whole 20%. So your premium is going to be about $30 more, so to speak, than Plan G, which is next to the F as far as coverage. Now, if you turn 65, what is it, Zach, prior to 2020 or after 2020? After 2020, you do not qualify with United Healthcare for Plan F. Some of the other companies you do, but it depends on which company. So if you enroll in G is just like F, except you must meet that deductible under Part B. And I've been telling y'all all night what that deductible is going to be for next year. Does anybody remember? It's $288. So on the Plan G, you get about a $30 difference in the premium, but you're gonna pay for that deductible. As soon as you meet the deductible for the year, then all of the other costs for anything that Medicare covers for the remainder of the year will be zero. Does that answer your question? Okay.
I'm gonna say something on that too.
Okay.
One thing that you, I think, also in the question was, would it be better if I got G or better if I got F? As long as long as you got F, keep it. G is just as good as F, but you got that Part B deductible, and that Part B deductible go up each year. So for that person, if that person have F, keep it. Now, anyone that qualified for Medicare before January 1, 2020, they are qualified to get F. Even now they are. But anybody that qualified for Medicare after January 1, 2020 and after, they cannot get F. They have to get G or any of the other plans. So for her, keep F and going on about her business.
Okay, so F is going to be expensive, and remember I told you with what's happening with the insurances for next year, it's going to be a larger. So I just want you to embrace. I want you to brace yourself for the increase that's coming up with the supplement plans and the things that are going on with the other plans. But you can have F, but it's what Zach has actually. And he's now 71, and when he was 65, he hasn't paid for any hospital bill, any doctors, any rehab, anything, because Medicare is taking care of the 80%, and this Plan F is picking up the entire 20%. So all he has to worry about is getting better. He doesn't have to worry about how he's going to pay the medical bills that he's incurred. These are very good questions. I really appreciate everybody participating. Do we have some more, Linda?
No, we don't have any at this time.
I have a question. I am not 65, but I'm disabled collecting Social Security. When I do turn 65, will there be a change?
Okay, so you're under 65 now, you're receiving Social Security disability?
Yes.
Yeah.
Okay. So when you turn 65, Zach, you want to help me?
Well, when you turn 65, well, I don't want to ask your age now, but they change things every year, especially when it comes to Medicare Advantage plans. So if when you turn 65, if you're disabled, I can tell you right now, you would want to buy a supplement along with the drug plan. And the reason why I say that is because it depends on, your medical, and you need something that's going to be there for you where you don't have to worry about trying to figure out this doctor or this hospital or that physical therapy place. You would be better off. I don't see anything changing in the Medicare supplement area. The only thing that would change would probably be the premium. The Advantage plan, yes, they're gonna change, and they're gonna change differently each year. So, but I think you'll be okay. So I wouldn't worry about that too much.
Okay, because I'm in the special needs, so I just wanted to make sure what's going to change later.
Yeah, we if someone asked me probably in June of this year what are going to be the changes for 2026, it's no way that we could tell you because they don't even tell us. So we wouldn't. Nobody knows anything but the companies that's putting the plans out there, or Medicare. But Medicare basically is not going to change much at all. I can tell you that. Only thing that change is the companies and what they do. But I think you'll be fine.
I'll be in prayer. We still got 3 more years to go, but I appreciate you.
I think you'll be fine. I think you'll be fine. That's a short time. I think you'll be okay with no problem.
Thank you very much.
Okay. All right, I love the questions. So I just been sliding through these next slides about, we've already talked about different things. We're talking about mistakes that you could make. So the biggest mistake people make is signing up for Medicare when they don't need to. We talked about this earlier. If you remain on your employer's health plan, you don't need to enroll in Part B because you're going to pay that $185 plus what you're paying for on your job. So don't sign up for Part B until you need it. Let's see. What is this? Oh, a lot of people think that Medicare covers long-term care. Long-term care is not covered by Medicare. So a lot of people that are retiring, you want to make sure that you've accounted for long-term care. You may have a long-term care policy. About 70% of Americans over the age of 65 may need long-term care during their lifetime. And I'm not going to say a lot about that, but it's not the same as Medicare. If you have questions, we can talk about that later. This is the month of celebrating our veterans, and we honor them because of the sacrifice that they have made for our country so that we could live in the freedom that we do and enjoy the freedoms. So we want to take this time and offer thanks and honor to all of the veterans that are on this Zoom meeting tonight, and we want to thank you sincerely for your service. CHAMP VA is health care for the family of a veteran who is deemed 100% disabled by the VA or has died as a result of the service. So if some of you are on CHAMP VA, you can ask about that, but that gives the surviving family coverage under his benefits through CHAMP VA. Here's the TRICARE that we've talked about a couple of times. People that are turning 65, you've got to sign up for A and B and keep your information in DEER as current. If remaining TRICARE eligible, if you're entitled to premium-free Medicare Part A, you must also have Medicare Part B to keep your TRICARE regardless of your age or place of residence. If you have Medicare A and B, you automatically receive TRICARE benefits under TRICARE for life. Keeping your information up to date in the Defense Enrollment Eligibility Reporting System is the key to ensuring effective, timely delivery of your TRICARE benefits.
Well, I'm on the Medicare call on my computer.
I'm almost at the end. So, those of you, we're independent brokers. We offer consultation to anybody that needs our help. If you decide on a plan that you like, and we will do the work for you. We write up the applications, we get everything set up so that your insurance can start when it is supposed to start. Once we enroll you, that is just the beginning of the relationship we have with our clients. You are free to reach out to us at any time during the year. If there are things that you need or questions that you need to answer, that's what we're here to do. So we sign up, we do the consultation. Step 3, you can tell anybody about us. Most people are confused about Medicare, what's going on. It doesn't have to be. Let us make it simple for you. Let us help you. We bring to the table a wealth of knowledge and experience that you can count on, and we can put you at ease and save you time and frustration. We will empower you to have the confidence to make good decisions. It's what we want to do. What else? Okay, we're very proud to serve you. Everything you need to make the right Medicare retirement choices for you and your family. Our services alone worth lots of money, but we offer at no cost. Thank you for joining us at the Edwards Medicare table today, where there is always a seat for you at our table. So now we're going to serve a great big thank you. Thank you so much for stopping in. Your time is something you never get back, so we don't take it for granted that you gave us your time this evening to learn and to empower yourself about this valuable insurance. We hope that we've enlightened you with the changes that are coming about, understanding the plan that you already have, the next move that you need to make, or if you just okay staying where you are. So how do we do? Give us a call. We're not just experts on Medicare, we're valuable resources for all things related to retirement. If you got questions, ask. There's no such thing as a silly ask. I need to go back there. Let's see. Okay, I guess I'm winding up now. I'm ready to take any additional questions.
This is Rita. I would just like to thank you for providing this information to us. And I don't know if Pastor is available, but if she is not, thank you so very much because the information you provided to us was so valuable. There was so much for us to learn.
I'm here, Rita, real quick.
Okay, so I'm going to turn it over to Pastor.
Yeah, real quick.
Oh, she is here. Huh? Okay.
Yeah, Diane, thank you so much for this invaluable information. We appreciate you taking out the time to just share with us and even to spend the extra time to answer all of the questions. So I know that we have been empowered and we have your contact information for those who need to reach out to you.
That's right.
Linda Smith, I'm grateful for you as leading the Seasoned Saints ministry. Thank you for your continued dedication to ensuring that our seniors have what they need. So God bless you all. I'm going to have to go off camera. Good night, everybody.
Good night.
Thank you, Pastor.
Good night, Pastor. Ms. Diana, this was an amazing presentation. I've been trying to get this. I'm a nurse, full disclosure. And I've had so many questions from people, my patients, myself, and this is the best presentation I've heard.
Oh my God.
Thank you.
Thank you. Thank you so much. That warms our hearts and it makes us just know that we're doing the right thing. We pray over our business and we just do it as unto the Lord is how we do our business, and we're here to help people, not to hurt you. So to hear you say that just means everything to us.
You're one of your members, our wonderful longtime client and friend, Lanita. I guess she was the one that asked us to do it, for you guys, and she's such a wonderful lady. We've really enjoyed her as a client over the years. Lanita Castillo.
Yeah, we love her too.
Yes, we do.
She had to get off the call.
Oh, okay. But she's wonderful. Quite a few folks in Bristol. Let's put it like that. So we enjoy.
Yeah. We love what we do, and it's been a pleasure to serve you tonight. The time just went by wonderfully, and I love the questions. I really do. So don't even
question for you, Ms. Diamond. Again, this is Roy.
Yes.
Let me just make sure. Is there a mechanism for us to contact you for questions further? Because I see the 804 number. Is there?
Yeah, that's us. That's us. The 804 is there.
And the website? Is there a website?
Oh, she didn't put it on here. Yes. Let me give you the website.
Oh, wait, I see it. No, Diana. Okay, I got
those
it.
are our emails, but we do
Those
have a
are our
website
email
too.
and phone number.
Great. Because I do have other folks who were not able to come on, and I just forward that to them.
Well, yes, please have them to reach out to us. We'll be looking for their calls. Just let them know that Roy sent you, send them our way, and we will definitely help them.
Thank you so much.
I see you down my way. I see you down my way. I'm in Caroline County. You're just
not that far. Yeah, my beautician is in Caroline County. That's not that far from where we are at all.
Okay, do we have anyone else on the line that have any questions? Anyone on the phone that have any questions?
Now is the time.
Okay. we want to thank Diana and Zachary for taking time to answer all our questions about Medicare and the changes that are coming up. And if y'all have any additional questions, y'all please feel free to give them a call. Also, if fill out this.
Hello.
Hello, go ahead.
I'm so sorry. I've been trying.
Go ahead, y'all. You've been trying to go ahead.
Yes, I was introduced by Mrs. Lanita Castilla, a very nice friend.
Oh, yeah.
Yeah, and I did reach out to Mr. Zach, and he gave me some information. So, how can I apply for Plan F to cover the 20%, please?
Just
Because I'm going for surgery soon.
yeah, Zach, he said he reached out to you. You would just give us a call and we'll ask you your situation and some questions. And
Mr. Zach already told me what to do, and I already applied.
Okay, good.
Yeah, but
really,
been denied.
if you want to, just give me a call back tomorrow on that top number, that 330-0090, and I'll discuss it.
Yeah, I have your number. Yeah, I have your phone number on my phone.
Right.
Yeah, I'm sorry. I was making a mistake. I was going to join to ask questions, but it's okay. I'll just call. I'll talk to you tomorrow.
Yeah, I remember you.
Yes, sir.
You just give me a call tomorrow, and I'll answer your questions. Your personal questions or whatever like that. I'll be more than happy to.
Okay, sir. All right. Thank you so much.
Okay.
Thank you. I really enjoyed it, and I'm very grateful. This is so. I wish I can have all this thing in my video so I can go back and review it. It's really nice. Very grateful for what you did.
Thank you so much for that wonderful compliment. We appreciate that. And we want to challenge everybody that was on the call and those that that couldn't make it. Please